You don't need fancy high-intensity interval training workouts to help you burn thyroid belly fat quickly. In fact, good old-fashioned walking is one of the most effective weight loss exercises you can do as a thyroid patient if you do it correctly. Here are 8 walking hacks to help you do just that. Hack number 1, use interval walking training, or IWT for short. The reality is that walking was never intended to be an exercise, but with how sedentary most people live, walking has now become a legitimate form of exercise. It's perfect for thyroid patients because it's low intensity, low impact, and because it puts your heart rate in the ideal rate for boosting your thyroid. But it has one fatal flaw. Your body quickly adapts if you walk at the same pace over and over and over again. The solution to this problem is known as interval walking training, or IWT. This simple walking technique is enough to prevent that adaptation that I just mentioned, which means that walking remains an effective fat loss tool and exercise. Here's how to do it. First, you walk normally for 3 minutes, then you walk fast for 3 minutes like you're late to a flight, and then you repeat this 5 times for a total of 30 minutes. Believe it or not, this method of walking is up to 2 times more effective than the standard advice of just walking 10,000 steps per day. It's also been shown to help you with mood and sleep, and it can help you burn fat faster than just standard steady pace walking. Hack number 2 is to walk at an incline. Walking uphill or walking at an incline is enough to increase calorie burn by 50% compared to just walking on a flat surface. It activates your glutes and legs more intensely, which helps to build lower body strength. Because your lower body contains roughly 40% of the muscle mass on your body, this is a huge activator of both thyroid function and your metabolism. This isn't going to take the place of strength training. However, it is a big stimulus on your lower body compared to just walking on a flat surface. If you don't have any hills nearby, then the next best thing is to simply walk at an incline at about 12 to 15% on a treadmill. For best results, make sure that you maintain this incline and just adjust your pace if you find it too difficult. It's far better to keep your incline high and your pace low than vice versa, especially for thyroid patients. Hack number 3 is to add extra weight when you walk. Walking with extra weight isn't just about burning more calories, although it will do that too. What it's really about is resetting your brain's subconscious weight setting. This is often referred to as the gravitostat theory of weight loss. This theory suggests that your brain is constantly assessing how much you should weigh based on how much load is put on your joints, your bones, and your tendons when you're walking around each day. When you are heavier and this load and tension increases, your brain senses these changes and makes adjustments to both your hormones and your appetite to naturally help you lose weight without any extra effort on your part. When you walk with a weighted vest, you are actually tricking your brain into thinking that you are heavier than you really are. This automatically triggers beneficial changes in your body to both your hormones and your metabolism that makes weight loss way easier. This might sound crazy if it's the first time you're hearing about it, but there's solid evidence to suggest that this may be true. And even if it isn't, it's still the case that walking with extra weight will help you burn more calories and will help you burn more fat. Hack number 4 is to make sure you track your steps. The goal here isn't perfection, it's just momentum. Why? Because your thyroid thrives with more physical activity. The more you move, the more active your thyroid hormones will become. This is because your thyroid, of course, helps to regulate metabolism, and one of the main regulators of metabolism is your muscle mass. When I tell you to track your steps, some people may think what I'm really focusing on is quantity instead of quality, but that's not true. When it comes to walking, quality is way more important than quantity. That's why we've been talking about things like adding extra weight or walking at an incline. The quality of these steps are much more effective and beneficial than just walking on a flat surface. But it is also true that you need a baseline level activity if you want to see results. And tracking your steps is still important because it will help you stay consistent. What you track gets measured, and what you measure gets improved. So your goal here should be to get about 7,000 to 10,000 steps per day, but focus less on quantity and more on quality, like I just mentioned. Hack number 5 is to make sure you are tracking your heart rate when you walk. You get the most benefit to both fat burning potential and thyroid boosting potential when your heart rate is in what we call zone 2. And what might surprise you is zone 2 is a relatively light form of exercise. In fact, when you are in this zone, you should be able to hold a conversation with somebody who is next to you. This form of exercise is perfect for thyroid patients because it reduces the risk of injury, allows you to recover quickly, and is accessible to all fitness levels. It also provides a bigger boost to thyroid function and fat burning potential compared to other zones of exercise. But the key here is you won't know you're in it unless you are tracking your heart rate. Your zone 2 level will vary based on your age, but here's how you can easily calculate it. Start by taking the number 240 and subtracting your age from that value. This will give you your maximum heart rate. You then take this value and multiply it by both 0.6 and by 0.7, which represents 60 to 70%. The range that you get between these two numbers is considered zone 2 training for you. Here's an example, assuming you are age 40. 240 minus 40 gives you 200 as your maximum heart rate. Zone 2 for this age range is between 120 and 140 beats per minute. Now, all you need to do is make sure that you walk at a level which allows your heart rate to get to this point and stay there. You may find because of your exercise capacity that you can get into this zone simply by walking on a flat surface. For others, you will probably find it's required that you either add weight or walk at an incline to get there. It doesn't really matter how you get there, just make sure that you get there and that you track it so you know you're there. Hack number 6 is to take walks at night. Feeling stressed or anxious? Night walking is for you. The simple act of walking at night does a couple beneficial things for thyroid patients. First is that it can help reduce cortisol and help you manage stress. And this by itself is enough to help reduce belly fat. Second is that it can help balance mood, which is great if you have thyroid-related depression or irritability. And third, it can help improve your sleep, which is great if you have thyroid-related insomnia. But remember this, high-intensity exercise, if done at night, can actually interfere with sleep, whereas low-intensity exercise can actually improve it. For best results, make sure that you're walking 20 to 30 minutes after dinner and at least a couple hours before bedtime. Hack number 7 is to walk after meals. If you are somebody who struggles with thyroid belly, post-meal walks are perfect for you. Even a quick 10-minute walk after a meal can help aid in digestion. It also encourages the incoming calories that you just ate to be used as a fuel source instead of being stored as fat. If digestion is a problem for you, then take a walk 10 to 20 minutes after a meal. And don't be afraid to do this multiple times per day because of course you will probably have more than just one meal each day. Hack number 8 is to walk after you work out. This is great for thyroid patients because it helps them to recover more quickly from their workout, and it also can help extend that post-workout fat burning window. It's already hard enough as a thyroid patient to lose weight, so anything that can make this process easier is well worth it. Here's how it works. Right after a workout, your body is primed to burn fat as a fuel source instead of carbohydrates. This is due to the release of hormones like testosterone, growth hormone, and adrenaline, which help your body metabolize fat cells. Walking after a workout helps your body circulate these hormones so they can make it to the fat cells that you need to burn. It also helps to reduce the cortisol spike that occurs after you work out, and it can boost T4 to T3 conversion. For best results, walk 10 to 20 minutes after a strength training session. To recap, if you are a thyroid patient who wants to walk to lose weight, here's what you need to do. Walk 7,000 to 10,000 steps per day. Make sure that you are tracking your steps daily. Make sure that you are staying in zone 2 while you are walking. This means you'll probably need to track your heart rate. Aim for 1 to 2 30-minute walks per day for a total of 30 to 60 minutes. Add weight or an incline if you need to increase intensity. And lastly, make sure you stay consistent. Walking is hands down one of the most effective exercises for thyroid patients who want to lose weight. And yet so many thyroid patients do not take advantage of it. If you are someone who needs help losing weight with your thyroid problem, make sure you check out this video next.